Welcome to the online resources for endoscopy at University Hospitals Plymouth. When we are unwell, investigations such as a physical examination, X-rays and ultrasounds cannot always provide all of the answers we need. In these instances, we need to take a closer look inside the body. Often it's possible to look inside the body by performing an endoscopy. An endoscopy is a minimally invasive procedure which uses a long, thin tube with a camera and a light, called an endoscope, to look closely at the organs and tissues inside the body. To perform the procedure, the endoscope is gently passed inside the body through a natural opening, such as the mouth or the rectum. We perform endoscopies to diagnose, monitor, and treat symptoms of the digestive tract. There are several different types of endoscope. Each one is specific to the area of the body that needs investigating. The most common types of endoscope include a gastroscope and colonoscope. A gastroscope is a flexible endoscope used to look at the esophagus, which is also known as the food pipe, stomach, and duodenum. A colonoscope is used to look inside the large intestine, or colon, by passing the thin, small, flexible scope through the rectum. During the procedure, the endoscope is carefully and slowly guided through the area of interest. This will either be down the esophagus to the stomach and duodenum, or through the rectum into the large intestine. As the endoscope moves through the body, the endoscopist watches for any abnormalities within the tissues. The endoscopist will introduce air to expand the digestive tract so that they can take a closer look and fully investigate areas of interest. An endoscope can also collect tissue samples, called biopsies. A biopsy is taken using a small pair of forceps which are pushed through a port within the endoscope. If the endoscopist takes a biopsy, you won't feel it, so we will tell you during and after the procedure if it has been collected. Once the endoscopist has fully inspected the digestive tract, the endoscope is carefully removed and set aside to be thoroughly cleaned. Following the endoscopy, you will spend some time recovering at the hospital, where you will be closely monitored by a team of nurses until you have fully recovered from your procedure. Your recovery time will be dependent on the method of pain relief you have chosen and the type of procedure you are having. Any samples taken during the endoscopy are sent to a laboratory where they're analysed by a pathologist. Your GP or your referring clinician will tell you your results. The results from the samples, along with the images from the endoscopy, are carefully reviewed. This allows them to make a diagnosis and to recommend a treatment plan. We would like to help you prepare for the procedure and make sure all of the information given to you by the hospital is clear and accessible. We have more information on our website, including how to prepare your digestive tract, information about your procedure, and what to expect after your procedure. Specific information on digestive tract preparation will depend on your individual needs and the type of procedure you will be having. You can find detailed information on our website. We provide a service for our patients which protects their dignity and respects their preferences. We support everyone visiting our unit and endeavour to make sure every patient's experience is as pleasant as possible. We understand that having a medical procedure can be daunting, so we will support you every step of the way, whether this is your first endoscopy or you are a returning patient.